Today I'm going to be showing you guys what the intraoral massage piece, TMJ treatment, looks like. This is a clip of just a segment of the intraoral massage. There are other muscles that I work on as well. However, this is kind of like the main muscles that I will be working on. So in the first clip, I am working on what's called the masseter. So that's our big muscle here. When you clench your jaw, you can usually feel it tensing up. So I almost always work on that muscle. As you can see in the picture, I'm sitting on the opposite side of the table. I'm using my thumb, not using a lot of pressure because again, I'm not trying to create pain. I'm trying to create a change in the muscle using safe and effective techniques. So I'm just going in, using my thumb and working with my patient, talking to them, making sure that if there is an area that they're feeling tenderness, that it's not too much. And I also want to know if that tenderness starts to decrease because it's a good indication to me that that muscle is responding to the treatment. And then the other thing that I also make sure that my patient is aware of is that consent is ongoing. So I typically will stop after 30 to 45 seconds and do a quick check-in, let them know or remind them that they can stop treatment at any time. I'm always making sure that they're continuing to feel safe, that the areas that I'm working on are feeling relevant for them, and then I will continue on. The other muscle that you see me working on when I'm using my pinky finger is called the lateral pterygoid, and it's this little guy up in here. So I use my pinky finger. It's hard to explain it on Josh, but I go up and I'm pushing in on that area. But again, it's a big piece of communication between my patient and I. I like to make sure that they let me know if they're feeling that, and then let me know if that starts to decrease. I usually just get them to put their hand up. And then again, I don't typically spend a lot of time working on it. I do it in segments. So I would take a break, give them a moment, and again, check in and make sure that they're feeling okay, still feeling safe, that the area is still feeling relevant for them, and then we'll continue on. If I'm working in the area and there's really no tenderness or anything, we move on to another area, because if the muscle is not telling us that it's a relevant area, there's really no point for us to be working on it. So that's another piece of the communication between my patient and I.